Action.
All right. Hey guys, how's it going? This is Ulysses again with Amici Hospice, and today we're going to go over our admission assessment. All right. So guys, after eligibility has been ran and explanation of benefit packet has been signed and dated, this is where the RN comes in or the nurse comes in for the RN initial assessment, the admission assessment. Okay, guys? This assessment is where we define whether the patient is eligible or not eligible for hospice. And what we do is we are here to assess the patient and create a report. This report will be reported to our medical director at the end of your assessment, and our medical director is the one that's going to go ahead and provide the thumbs up or the thumbs down whether the patient is eligible for hospice and as an adequate hospice candidate. Okay, so what we want to do is this. We want to start off by collecting as much information as possible, correct? We want to make sure that prior to getting to the patient's house, we talk to the family and we ask the patient to pull out all their medications that they have. Anything they're taking, even if it's over the counter. A lot of the times you'll get and they'll pull out all the medication and then you'll start asking questions and they'll be like, okay, he actually has this at his bedside, or this is actually something he has up in this cupboard. He puts it up here so he doesn't forget. Make sure you let him know, give me all the medications, anything he's taking, even Dimetapp, Tylenol, something as simple as Tylenol, bring it out, okay? The medications will really give you a great idea on the patient's health status and what he's currently going through, right? So if the patient has a lot of hypertension medications, heart meds, diuretics, you obviously know that the patient is currently going through some kind of heart issues, right? If there's a lot of respiratory meds, you have puffers, you have albuterol, two different types of puffers. Maybe even they already have an oxygen machine. You already have that in your mind that there's some respiratory issues going on. Sometimes the patient is showing no signs of symptoms, but there is a diagnosis there. So, like I said, these medications will go ahead and give you a better idea of the patient's health status. Once you have the medications, at bedside, you want to go ahead and let the patient know that you will be performing a head-to-toe assessment. You assess the patient from head to toe. We want to make sure that you try and get as much information as possible. The more symptoms, the more comorbidities, the better a candidate for hospice. If you're not sure if it's something worth mentioning, put it on there. If it's something like, I had a cough, I've been having a cough for the last 6 years, I just can't seem to shake it, put it on there. What we want to do is we want to collect as much information as possible to be able to provide for our report at the end of the assessment for our medical director. Besides your head-to-toe assessment, you want to document any wounds, any redness, any swelling that you might see. Take pictures, guys. It's really important that you take pictures. This way you can go ahead and send it to doctor prior to your meeting with him on Google Meets or whatever it is that you guys use, or FaceTime. You also want to ask the patient what previous hospitals they have visited. A lot of the times, patient is very unaware of their diagnosis. They don't know what they have. Some patients don't even know why they're taking certain medications or why they're even prescribed. Patient could be taking, carvedilol. They could be taking lisinopril. They could be taking aspirin 81 milligrams. And they might not even be aware that there's some kind of heart issue going on. They're taking blood thinners. So with that being said, one of the best ways to also get history, guys, is to request H&P, which means it's just history and physical exams, that have done at previous hospitals. If the patient is in Los Angeles, let's just say, then we ask them, what hospitals have you guys frequented? Oh, Kaiser Sunset, Kaiser LA, Kaiser West LA. We write all of these down. With our HIPAA consent that we signed earlier, we're able to provide a request for this type of information. The more information that we have, the better we're able to provide quality care, guys, okay? After you do your head-to-toe assessment, comorbidities, Allergies are also very important. You also want to provide any symptoms that are showing that he currently doesn't have medication for. So during your assessment, you want to ask, how are you sleeping? Are you sleeping okay? You know what, Ulysses? I can't sleep due to this pain or due to anxiety. I haven't been able to sleep for 3 months. You're looking through his medications, there's no sleep aids. This is something you might want to, on your assessment sheet, you might want to make a little space for recommendations to where you would report this to the doctor to see if he wants to provide anything for insomnia. Could be trazodone, it could be melatonin, just depending on the severity of the issue, the doctor will order the correct medication, right? Let's just say patient is taking 20 meds. You ask the patient, how's your bowel movements? I have a hard time with bowel movements. You look on his medications, there's no Senna, there's no, Colace, there's nothing of that. Then you might want to go ahead and mention that to the doctor. The doctor will give you an order for it. Remember, we're here to provide symptom control and comfort care. So if we see any symptoms that are happening and are not being controlled, let's bring it up to the doctor. These are all things that you want to write down, prior to your assessment. Remember, guys, when you talk to the doctor, you want to make sure that you're 2 steps ahead of them. You don't want the doctor asking any questions. This would be the ideal assessment, to where you're going to let the doctor know exactly how long, when, where. These are all things that the doctor's going to want to know. The best type of assessment is where you give your report and the doctor says, great job, let's go ahead and admit him. You don't want you don't want to say something as simple as like, oh, the patient is constipated, right? You want to say, doctor, patient has been having issues with constipation for the last 4 or 5 months. He's only having 1 bowel movement every 3 or 4 days. It's a lot more detailed. It paints a picture to the doctor of how severe the issue is, and this way he can go ahead and provide the right medication for the patient. You always want to paint a clear and detailed picture, guys, when talking to the doctor. Doctor's very busy. We want to make sure that he doesn't say, get all this information and call me back when you got the right info. That's not the kind of assessment we want. We want to make sure we provide everything, right? Okay, as you are assessing your patient, you want to keep in mind, how can I help this patient? How many visits does this patient really need, right? Does he need skilled nursing once, twice a week? Is the patient going to need CC soon? Is the patient declining? Does the patient look like he's declining fast, so we're going to need continuous care fairly quick? These are all things that you want to have in mind during your assessment. Bath nurse. Does the patient need help with bathing? Does the patient need a shower chair? A shower bench. These are all things that we want to keep in mind. Do they have a tub? Do they have a walk-in shower? We always want to make sure that we don't just order these things. As we assess, we're providing a care plan for the patient along with the family. We want to make sure that they feel involved. We want to make sure that they're part of the care plan so that they don't feel like we're just coming in and barging everybody out of the way and giving orders. That's not what we do here. We create a care plan with the patient and the family. The family's always the boss, and we make sure that they agree to whatever it is that we recommend, right? Well, we make sure that we let them know so they can agree to anything that we possibly recommend. Like I said, frequencies. Does the patient need wound care? Is wound care something that I might want to consult to make sure that we treat these wounds? If you don't know the severity of the wound, if it does need treatment, take a picture of it, measure it, send it into the office. Ms. Seaham will take a look at it, and she'll decide whether the patient needs a wound consult or not. And then we can communicate with our wound care companies to make sure that we provide, quick care. Does the patient need a hospital bed? Is the patient bedbound to where we need to order a low air mattress? You guys got to constantly be asking these questions to make sure that we get everything, at once, guys, and we start providing great care initially. The first 48 hours of our admission are the most crucial, guys. This is where the family decides whether they made the correct choice with Amici Hospice or whether they probably should have went to another company. So the first 48 hours are crucial. This is where we need to make sure that patient got his medications. As RNs, I want to make sure that you guys are aware if the patient got their meds or not. It's very easy to order everything on Slack, but we do have a lot of patients. We do, nobody's perfect. Things could fall through the cracks. So as RNs, I would like you guys to kind of follow up and basically ask if the medications have got there. You guys put the order in yesterday afternoon, call your patient next morning, or even tag Ella. Hi Ella, good morning. Have medications arrived for our patient? Because the last thing we need is for the patient to call and say, where's my meds? You told me that they were going to arrive. They haven't arrived yet. Then there's already a message on Slack, but we failed to communicate on Slack or look on Slack, and it looks like we don't know what we're talking about when the patient is calling, when all the information is there. So let's make sure we follow up with our orders. With that being said, our report will be on Slack. All our communication platform, Slack is our communication platform. So anything that you guys want to ask, anything regarding the patient, let's put it on there. This is why we have it, guys, and this is the best way to communicate because it is in real time. We got a great team who's constantly on it, and they'll make sure you get an answer. Miss Seaham is always answering. Myra's always answering. Alla is always answering. Scheduling, Dino's always answering. So, we got people constantly looking at Slack, so let's make sure we use it. That's the best way to go about it. Okay, so once we have all our assessment in line, we've asked all the questions, and actually we have an assessment form that Myra can provide with basically all of the symptoms. It's very easy with each system, from respiratory to cardiac to musculoskeletal, and you basically just go through the list. Arthritis, rheumatoid or osteo, coughing, is it productive, non-productive? If you guys follow that format, your assessment could be very easy, on top of whatever you guys think you might need to ask as well, right? So you follow that platform there. Couple key questions. Patient's bowel movements. We talked about that earlier. How frequent are their bowel movements, right? We want to make sure they're not constipated, or if they have diarrhea, we attend to it fairly quick. Sleeping habits. Is the patient sleeping well, right? If they're not sleeping well, their body's out of tune, they're tired, they're cranky, and this makes things a lot worse if you're not getting any sleep. Appetite. How much is the patient eating? You want to make sure that you ask what percentage of the plate and how many times a day. So one good way of asking, and this is the way I ask, is basically out of a full adult plate, how much does the patient consume? Half of the plate, a quarter of it, only a quarter. Okay, sir. And how many meals a day does he have? Well, he only eats twice a day, sometimes just one. Okay, so with that being said, you guys know that he's eating very little. So something should click and say there should be weight loss, right? Okay, so has there been any weight loss? And have you encountered any weight loss? Actually, yes, I've lost 20 pounds. Okay, they lost 20 pounds. In how long? Because they can lose 20 pounds in 2 years. They can lose 20 pounds in 2 months. They're both very doable. You want to ask the patient, okay, so you've lost 20 pounds in the last 2 months. Yes, sir. Okay, perfect. So you write that down. Now you have a clear picture. So when you do provide this to the assessment to your doctor, you can actually say that, doctor, the patient actually lost, they used to be 160, now they're 140. They've lost 20 pounds in the last 2 months. Their appetite continues to decrease. There is nausea and vomiting involved, and due to dementia, they're starting to pocket food. They're starting to forget how to eat. They're starting to, Another question could be, if there is dementia or Alzheimer's, is the patient holding food? Are they having trouble swallowing? Are they choking? Is there aspiration involved? If these things are happening, we should click. Let's get thickener for the patient. Let's educate the family on thickener. Let's make sure that the family knows that we shouldn't be forcing patients a lot of the times. Families think they're not educated, and families think that feeding the patient or force feeding them is going to make them healthier. They're not eating, they're not getting the nutrients that they need, so they're forcing that down the patient's mouth, which is going to cause aspiration, and that's the last thing we want. We want to let them know that, especially if the patient is not active, that the body isn't really requesting a lot of nutrients. The patient is mostly in bed, or the patient is mostly in a chair. They're not really active, so their appetite is very decreased. The body's not asking for your average amount of vitamins and nutrients and carbs and the whole works that a normal body would need. So a decreased appetite is just part of the territory along with the disease progression. They are losing appetite, so it's okay. We only give the body what it needs. We don't force it. If you know that the patient has a decreased appetite, this is where Ensure might be an option. The little milkshakes that provide all the nutrients and vitamins for the day. We only provide those to patients that have decreased appetite as well as weight loss. We don't offer Ensures to patients that are eating well, that have three meals a day. This is only in case of weight loss or bad appetite. Okay, guys, these are all things that you want to have in your assessment before you talk to the doctor. So once you have all this information, folks, you have all of this assessment. This is where the doctor comes in. You want to text the doctor about 10 minutes beforehand to let him know that you're going to provide an assessment for him, right? Hi, doctor. This is Ulysses. I'm going to have an assessment in about 15 minutes. Personally, what I like to do is, like I said, I like to give the doctor a heads up. I don't want any guessing. I don't want him asking. I want to make sure that he knows exactly what I'm dealing with. So what do I do? I go ahead and let the doctor know I'm going to have an assessment. I'll let them know patient name, age, possible diagnosis that we as RNs know that could be used, as well as I also like to send them a list of the medications. I usually write them on Slack. There will be a thread created for that patient already. So I just copy and paste it. I look on Slack on my phone and copy and paste the list that I already wrote on there and send it to the doctor. This way the doctor has an idea of what he's working with before you even get to his assessment, right? If there's any H&P, guys, any important H&P, let's just say some hospital paperwork that has diagnosis already on it from the last 3 years or whatever it is. Take a picture of that, send it to the doctor before your assessment. By the time, this will make your assessment a lot easier because now the doctor has an idea. He already knows. He's seen what you already sent. Medications, H&Ps, confirmed diagnosis. So this way the doctor can just say, you know what, Ulysses, thanks to the medications that you've sent and thanks to the confirmed diagnosis from Arrowhead Regional, Kaiser, whatever it is, whatever hospital they're at, I can see that the patient suffers from CHF. Let's go ahead and admit the patient for CHF. Like I said, we're trying to make this as easy as possible for the doctor. Once the doctor is confirmed through telehealth, we want to make sure that we provide proof that there was a face-to-face visit with the patient and the doctor. This is where it's really important, and doctor already knows, it's really important that we take a screenshot of the phone with the doctor on it as well as the patient. This is going to go ahead and prove to Medicare that we were there on a certain date, that the doctor did assess, that we did provide a report, and there was actual face-to-face where the patient actually met the doctor and vice versa, and there was communication. And this is key in one of our admissions. If we don't have that, then we got to go back and redo our assessment. Okay, guys, when we do the assessment, we got to make sure that we come to a conclusion of what the hospice diagnosis will be. This is why it's important that you send all this information to the doctor. You want to make sure that by the time you finish your assessment with the doctor, you guys have agreed on an admitting diagnosis. One thing to keep in mind is that in order to have an admitting diagnosis, you need backup to basically prove your admitting diagnosis, right? You don't want to say COPD if the patient doesn't have any puffers, isn't short of breath, isn't on supplemental oxygen. So we need to make sure that whatever diagnosis we do use, there has to be some kind of factors that prove that that diagnosis is legit for hospice, okay? If we're using a cardiac diagnosis, we need to make sure there's cardiac meds, whether it's blood thinners, whether it's lisinopril, Eliquis, a lot of these medications that are heart related, right? Okay. So, like I said before, just a quick recap. We asked for medications. We ask for any paperwork from previous hospital visits and doctors. We do a head-to-toe assessment. We jot down any recommendations that the patient might need during our care if they're not currently taking medications for those recommendations. For instance, I'm sorry, really quick, let's just say patient is on melatonin for insomnia. Now, melatonin is for insomnia, but if the patient is telling you that melatonin isn't working, then let's ask for something a little bit stronger, guys. Okay? Okay, with that being said, after our assessment, we call the doctor, we give our report, the doctor gives you a diagnosis, you decide with the family what the frequencies will be for the SN, HA, social worker, as well as the chaplain. Once we do that, we go ahead and put all our report on Slack. We make sure if there's any medications that need to be ordered, we put them on Slack and we tag Ella. Any new orders as well. We put the frequencies on there. And guys, this is key. We need to make sure that we put the patient's information and contact information. Name of the patient, date of birth, address, who is the point of contact, whether it's the wife, the son, or the actual patient. This has to be initially done because this is where we're going to get all our information to deliver DME, to deliver med supplies, to deliver, you know. Speaking of which, let's also get, you know, diaper sizes. Make sure we order wipes, urinals if they need to. We never want to over order, guys. If the patient is unsure, then let's just put that order on hold for now. You let me know when you need it. Do you guys need chucks? Well, I guess you could send them. I'll tell you what, I don't really think you need them if the patient is, you know, ambulatory. So let's put those on hold. When the patient starts being bedridden or having accidents in bed, then we can go and order them. How does that sound? Okay, that sounds like a good idea. Okay, guys. Right? In conclusion, report on Slack. Anything that needs to be, any information that your fellow teammates might need, let's go ahead and put it on Slack. We are a team here, guys, so I kind of expect the RNs to reach out to their LVN, introduce themselves. You know, we are a care team here. Anyone from the RN, LVN, HA, and social workers. You guys want to have great communication and know who's on your team for this patient, because teamwork is very crucial here, guys, especially for the RN who only comes in twice a week. I'm sorry, not twice a week, I apologize. Once every other week. So you want to make sure that you know what's going on with your patient, right? And Slack is the best way. So reach out to your LVN, introduce yourself. Hey, it looks like we got this patient together, you know. Please let me know if you need anything. Sounds good. And, you know, we create that relationship. You know, teamwork makes the dream work. So with that being said, in conclusion, this is our admission process. Please reach out if you guys need anything. We'll be more than happy to help you guys out. I hope this helps, guys, and you guys have a good day.